Hospitals are struggling to keep up staffing levels amid the recent spike in COVID-related hospitalizations, along with an exodus of nurses and other workers from the field. News 12's Brian Donahue talked with two New Jersey nurses for the view of the recent spike from their perspective.
Mount, a nurse at Virtual Memorial Hospital in Mount Holly, wishes you could go to work with her to see what she sees.
I've seen many people crying. You take it for so long. With the mask and all the PPE, all you see is their eyes. And you can see it in their eyes.
Benita Herndon, an ER nurse at University Hospital in Newark, is worried about how they'll handle the latest crush of patients amid staff shortages and crisis levels of burnout.
I've been a nurse for a little over 25 years. And trust me, I've never seen anything like this.
On a week when the number of hospitalized COVID patients in New Jersey rose to their highest level since May 2020 and deaths topped 100 for the first time in 10 months, the stress and trauma nurses and other frontline workers are facing is back in full force.
How are nurses coping?
They're not.
Yeah.
I think, it's just building and building and building.
With the latest wave, the stress of long days and layers of PPE is compounded by the struggle to fend off frustration because so many hospitalized patients are unvaccinated. And staffing shortages are stretching them far thinner than during the first wave. In October, even before the Omicron wave, mind you, a Morning Consult poll of 1,000 healthcare workers nationwide found 18% had quit their jobs. 31% are considering leaving. Mount, who, like Benita Herndon, heads her local chapter of Health Professionals and Allied Employees, the largest healthcare worker union in the state, those poll numbers seem low. Both have seen many older colleagues retire. Younger nurses have left to take lucrative jobs as temporary contract workers or travel nurses, as their expertise becomes more in demand nationwide.
For these past few weeks, the shortage of nursing is really the brunt of it all, and the long wait times. So we don't have enough staffing to accommodate taking care of all these patients.
The crisis may feel distant from our living rooms. It's all too real in the places that nurses like them work. Compared to that first COVID wave when our world was filled with parades and concerts, signs and tributes to these frontline heroes, things are just as rough and, well, maybe not much has really changed. Except maybe that so much of our cheering has stopped.
I dread waking up this morning because I know I was going to have so many texts from people who are already at the brink.
Brian Donahue, News 12, New Jersey.